All right, as we heard earlier from Jasha, 2 people have died among the 58 diagnosed so far with Legionnaires' disease in Harlem.
Health officials say the outbreak began last month. Unfortunately, deadly outbreaks of Legionnaires' disease have happened in our area before. I know 10 years ago, 2015 in the Bronx, there was a major outbreak.
Yeah, we've been dealing with these kinds of things periodically with Legionnaires. Joining us now with more on what we need to know is ABC News medical correspondent Dr. Sutton. Thank you, because I mean, 1 death was too much. And now we have 2. And now you have communities who are on high alert, very afraid, and they're like, what is it even?
Yeah, we take a moment to educate ourselves and have more awareness to hopefully save some lives. So Legionnaires' disease is a bacterial infection, and the reason why it can be difficult to track is because it usually gets to people through water systems. You think water cooling towers. It is not something that is transferred from person to person. You get it from aerosolized water droplets from an exposed tank. And as you stated, when you referenced the 2015 outbreak, that was due to a lapse of inspection, cleaning problems, and water treatment issues. And in New York City, we're especially vulnerable because we have a dense population, an aging water infrastructure, and a high number of cooling towers. So this provides a breeding ground for this type of bacteria.
Okay, so what are the key symptoms and how quickly can it be dangerous?
Yeah, so the key symptoms of Legionnaires' disease are flu-like symptoms, which is difficult because it can look like anything. COVID, the flu. So if you're in the summer and you're near or exposed to these water towers, or you're finding, for example, in Harlem, that you have a cold in the middle of a summer, in the middle of the summer season, that should be a little bit of a tip-off that you need a little bit more investigation. Now, we're talking about this in emergency rooms around New York City with my colleagues in terms of testing. The type of testing that you would get with this infection is a urine test. That might not seem obvious, but that would be one of the ways that you get to the bottom of this, and it's treated with antibiotics.
Okay, if someone in Harlem has those symptoms, what do they need to do?
Yeah, I think number one, understand if you are at an increased risk. So those groups who are at higher risk are those above the age of 50, those who are immune compromised, and children. So if you have symptoms, you're exposed or in an area that has a high rate of number of exposures, and you are at risk, then you should get checked, at least a chest x-ray, a basic exam, and of course, the urine test is usually the most common test for this type of
But is that something you guys...
Oh, sorry. Is that going into the ER? Is that going to a primary?
It depends on your symptoms. So if your symptoms are comfortable enough to be able to be treated from the comfort of your own home, then I would encourage talking to your primary provider if you can, checking into urgent care. This is one of those problems. If you're not truly symptomatic, can easily be solved in urgent care. But if your symptoms are serious, then of course, an emergency room is appropriate.
I remember covering the breakout back in 2015 in the Bronx.
Yeah.
I mean, and that was pretty devastating. It killed 15 people. Why New York City?
You know, I think mainly because we're so densely populated. And one thing about New York City is that we have water towers all around us. Many people have no realization of this. And inspections are not always common. And sometimes they can lapse. And that can increase the risk. It's one of the reasons why public health is so important to understand the value of it. Many times when it's working, we don't see these types of issues. But when things break apart, we do see people get sick.
So you're saying water towers.
Yeah.
But what does that mean? Are we talking about you get your water from there? You've been around a water tower? Can you just give me a little bit more about?
Great question. So water towers are usually a part of larger buildings. You know, that can be water that is held as a receptacle to provide water to that building, also cooling systems. The thing about the summer is that it's often used as a cooling method to help save your air conditioner, and that can release those droplets that have the infection in them, and that can lead to your infection.
So can I just ask you really quickly, just a quick follow-up. Right now when people are going to the hospital and they tell them, I live in Harlem or a certain zip code, that is something that right now you guys are discussing amongst yourselves?
Absolutely.
Like, hey, test for it even if...
Absolutely. And one question I asked in the emergency room as an emergency physician is, what are you most afraid of? I think every person should lead with that when talking to an ER doctor. If you are concerned about your exposure to Legionnaires' disease, make that known so that you can at least rule that out and do the appropriate testing.
Great advice.
As always, Dr. Sutton, thank you.